Good evening, Doc.
Hey, good evening. What's
So
up?
nice to see you on this side.
Yeah, absolutely. Different, actually, perspective from this side.
Yeah, so people, you can't play with your mobile. Not
Yeah,
that you play
yeah.
with it. I mean, you like to save your eyes over there.
It's
So
it's a lot hotter on this side as well with all
with
the lights.
coming over there. Okay, so you're like Doctor, like James Bond 007, laser vision. Sounds good. Okay.
I don't know.
So
Can Mr. Jatia vouch for that? Then I'll accept
yes,
it.
okay. So let's get straight. Where did you study medicine and how long was it?
So, how long was it? Well, very long. So, I did my MBBS from KJ Somaya Medical College. And then I did my master's from KM. And I did 2 observer posts, one in the UK, one in the US. And came back prematurely because I realized that, in fact, in terms of eye surgery and ophthalmology, India is now the best place to be because of the sheer volumes that we do.
Okay.
And of course, the technology is available now. That is there.
So you're saying we're as good as foreign?
We're much better, in fact.
Yeah.
Yeah. So to give you an example, after my residency in KM, I did something close to 450 cataract surgeries. I had a colleague of mine who was in the US, who was just became a fellow. They call it a fellow there, and he just was on his 3rd or 5th cataract
Third or fifth?
surgery. Yeah, yeah.
Wow. So you did 450 in how much time?
It was in around 3 years.
Wow, that's huge, yeah.
3 years. So
Okay.
then after my observerships, I came back and I did another house post in Bombay where you easily was doing close to 15 to 20 in a day.
Okay.
And then started. So the total education time for me till I started private practice was probably close to 15 to 16 years
15, 16 years.
of medical education.
Wow, that's a pretty long time. But you were paid when you were doing the practice and all, no?
Which practice? My own private
No.
practice?
Before that.
I think people pay. Oh, before that. No, I wasn't.
No?
I wasn't. Till I
Okay.
got into my residency at
Okay.
KM, then we
Okay.
were paid, it's stipend, what they used to call. Something like 6,000 rupees or something a month,
Okay.
which we used to die to get from a municipal hospital.
So that means in spite of putting in a lot of money for your medical fees, there's a lot of money after that which you're going to put in for till you're able to practice?
Yeah, so I mean, education, your MBBS is what majority fees are. And then once you finish your MBBS, then the system that we had in those time was if you were a distinction holder or something in that particular subject, you would get that post-graduation seat. So I had a choice between ENT or Ophthal.
Okay.
At that time, Ophthal was a lot cooler because of the high-tech gadgets. I was looking for something like a 9-to-5 job, no emergency. So definitely didn't want to look up people's nose and stuff like that. So I thought Ophthal was the best way to go.
Okay.
And of course, once you start private practice, the investment and everything. So investing in place, equipment. So it's a pretty heavy investment.
Okay. Right. So tell us about EyeQ Vision Care and why the name?
Well, EyeQ Vision Care has now been there. I started it in around 2006.
Okay.
It's right now in, I had one branch now which is in South Bombay. I had a branch in Santa Cruz which I had to shut down because of redevelopment.
Yes.
The name was something, I was looking for something intelligent. So when you look at EyeQ and other things like that, it kind of was catchy and resonates. So it's EyeQ Vision Care.
Okay.
So it's something that, I think people can look at it and, kind of get the catch where I got EyeQ Vision Care.
Okay. So you come from a family, your dad is also a doctor.
Yeah.
So what does he practice?
He's a kidney specialist.
Okay.
And he's right now in Leelavati full time.
Okay.
Yeah. So, and he's still practicing. He's 70 plus. So
Wow. So are you going to continue practicing till you're 70 plus?
let's see. I'm planning my retirement thanks to meeting people like Saumil and all, who's encouraged me to plan my retirement by 56. But yeah, let's see.
Okay.
I think I'm right now in the prime of my practice, and let's see where the next 10 years takes us. Let's see where the economy takes us, where my investments take us. And my dad's doing the smart thing. He's a full-time job with no expenses. I've got a lot of a lot of expenses on my head, a lot of overheads, investments, every 2 years, 3 years upgrading machines. Equipment doesn't come cheap. It comes
Yes.
starting at 35 lakhs going up to, well, our LASIK machine, which is 3.5 CR.
Wow.
So imagine upgrading that every 3 years. So it's something that it's viable in a way, but it's something in the long term, if I'm going to look to really earn my own income and passive income, is let's see where the next 10 years with our government and where our economy takes us, right, Somil?
Okay. Okay. Now, simple question. Most of us don't go to the doctor until we have a problem.
Yeah.
So how many times in a year should you get your eyes checked?
At least every year, a normal
Once a year.
individual, if from the age of 3 onwards.
Okay.
If you are a diabetic, then every 6 months for sure.
For sure. Okay.
Because diabetic eye disease is irreversible. So you need to at least keep getting it screened every 6 months, catch something at a very early stage, so it's then treated, so then your clear vision can be preserved.
Okay.
So it's a very wrong perception or idea to actually come when something is wrong.
Wrong, right?
Yeah.
So it should be like a dentist appointment once a year.
Yeah, so if you get your blood checked every 6 months, 8 months, once a year, just go get an eye checkup. That's why NM has got an eye doctor sitting there pretending to, it's part of the package deal. You've got someone looking in your eyes, but you actually need to, if you're getting a blood test every year, just throw in an eye exam.
Eye exam over there.
There's a lot of things, even if you're a non-diabetic, things like glaucoma, there's certain, even, things like macular degeneration and other things, which if you detect early can be, it can be solved.
Solved over there.
To
Okay.
its,
So are there any do's and don'ts to take care of it?
Well, the first do is get your eyes checked every year. And whether you see your eye doctor every year or you see me every year, then once I examine you, I'll tell you what not to do. So that's the do and the don't.
Okay.
So as long as you get your eyes checked every year, then there'll be some advice that comes out at the end of it that'll say, okay, look, don't do this, don't do that,
Okay.
etc.
Okay. So
Fairly simple.
Simple over there. Okay. So come to the burning issue, mobile screens.
Yeah.
Most of us are just like continuously mobile, watching that mobile, everything we're consuming. Once upon a time we had one desktop which we used to keep watching over there, which had some distance. But nowadays the mobile is practically in our hands every time. The moment we get bored, we are sitting and watching a mobile over there. The moment anything happens, we are watching the mobile. You're reading your news on the mobile or on a Kindle.
Right.
So there's a thing called as this blue light.
Yeah.
So they are saying that this blue light, I think the Samsung phone has got an option where you can take out that blue light and it becomes a kind of tungsten kind of color over there.
Right.
So there are studies which says that it could be harmful. What do you have to say about that?
Yeah, so I was reading in the Harvard Journal of Medicine recently that they did a study, I think 8 months back. The problem is, in short, is actually LED lights. It gives off a lot of blue light. So whether it's your television, your tablet, your mobile, or the LED lights that you even put in your house.
Okay.
So what it does, it stimulates the retina cells.
Okay.
The retina is actually, even though it's part of the eye, it's actually more connected to the brain, more related to the brain. So it does two things. Your retina is what focuses color and light sensitivity. Those cells can get damaged with the blue light that LED lights emit. So they said that even things like macular degeneration, actually blue light could be a cause of it.
Okay.
Another thing that the retina does is it sends signals to our brains. So you have something in the brain called the hypothalamus, which is actually responsible for secreting things like melatonin, which helps us sleep at night. And it basically keeps our body in function and recognizes the natural daylight. So when you're supposed to be awake, and when it starts to get dark, when you're supposed to sleep.
Sleep, correct.
So all these tablets, your phone, your television, or even LED lights can actually, so even if you're, let's say this was your office environment and it was early in the morning, your body will not recognize whether it is day or night. And then there's a lot of sleep disturbances, a lot of sleep problems related to LED light and the blue light, which not only causes, of course, fatigue. You'll see people sleeping during the day. It causes a lot of psychological disorders. Not the light, but the lack of sleep. If you're, it's basically, well, we can get into the whole sleep cycle, but you need there are 3 cycles in sleep, and you need 3 of those to complete in 6 to 8 hours to be actually waking up and feeling like, wow. So you could be sleeping for 10 or 12 hours. The time you wake up, if you don't complete those sleep cycles, you can still feel exhausted.
Okay.
And you're wondering, I'm sleeping so much, but yet I'm feeling exhausted. So that's part of the problem with LED lighting and the blue light that is there.
So you're saying that a lot of people have become now night owls. People work at night, and till about 2 o'clock, 3 o'clock in the morning.
Yes.
And then in the morning you get up. So does that also affect your sleep cycle over there?
Yes, of course.
Okay.
Because LED lights at night, we're right now in a dark environment with all these lights. Our body's actually thinking
it's still day.
that it's still day. So it's stimulating all the hormones like adrenaline and other things. And adrenaline stimulates your glucocorticoids, which increase your blood sugar.
Okay.
So there's a lot of relation to how you sleep, to your lack of sleep and increased blood sugar and diabetes. And that's why they say diabetes can be reversible. So it's why they say lifestyle. It means all this, not just your diet.
Interesting. So contacts or laser? A lot of people, are right now into contacts. We have a lot of people wearing contacts over there. Some people look cooler wearing glasses. I feel that a lot of times over there. So what do you suggest? As a doctor, which is better?
Which is better? If let's say a scenario where I get a patient in, and I have a patient whose desire is not to wear glasses at all, correct? And if they were given a choice between which is better, contact lens or laser eye surgery, then laser eye surgery works out to be safer than wearing contact lenses.
Okay.
Contact lenses, the whole problem with contact lenses is that people are not taught the proper protocol of hygiene. You will see a lot of young people who are overexposing their eyes with contact lenses, wearing them instead of 6, they're meant for 6 to 8 hours. Then it depends how your body tolerates it. Some won't tolerate it for even 2 hours. But they'll even go beyond the 6 to 8 hours, and I've had patients who slept with contact lenses and had corneal ulcers, and which required then a corneal transplant altogether, which is a far more unsafe and unpredictable surgery. While in LASIK eye surgery, so I've got laser eye surgery myself 10 years ago, and if there was even a 0.1% chance of anything going wrong in terms of losing my quality of vision, I wouldn't attempt it on myself anyways. So it's very, very safe. It's much safer than wearing contact lenses. It's like a procedure. It's not really an invasive surgery.
Okay.
And you cannot lose your quality of vision in LASIK. Worst case scenario, if it doesn't work for you, then you can still continue wearing glasses.
Okay.
But the quality of vision will be the same.
Same over there. So LASIK, you can only go in for distance and not for reading. A lot of people above 40, you want to take out those glasses, keep on go to a restaurant, you keep reading that over there. So what is the option for people who want to go for something which is to remove their reading glasses also?
Well, there's a concept of what a lot of people are using, something what is called Monovision. So for you, for example, when you have to read, you've got to remove your glasses to read.
Correct.
You're not wearing bifocals.
Correct.
That is because you've got a minus number for distance, which means you're naturally nearsighted. So without glasses, you're nearsighted. So without glasses, you can read. So what we do is your non-dominant eye, we probably keep that myopia, that nearsighted is a -1, 1.5.
Okay.
And your right eye we correct for distance. So with both eyes open, you can see distance and you can see near.
Okay.
Correct. And that way it works. I do not suggest it on my patients at all, because you need good binocular vision. Okay, God has given us 2 eyes to see 3-dimensional objects. So if we're looking like at this mug here, and the reason why I can see the depth in the mug is because one of my eyes are focusing on this edge.
Correct.
And the other eye is focusing on this edge.
Correct.
In terms of monovision, then you don't get that. So things like if you're a sports player, racket player, or a cricket player, you won't be able to judge moving objects easily. and you will not. If you drive, driving could be a little bit difficult. Judging moving objects, housewives, and people who are working at home, correct, where they're generally happy with it. It requires a lot of counseling to do that. I do not. I just say, look, any normal person in life who never wore glasses, at the age of 40, 45, they were reading glasses. So let's knock out one. And reading glasses is something which is now, if you're reading a newspaper, it's considered a lifestyle thing. There's not many people who will now sit at a coffee table and read for like 1.5 hours. Some might, but that tendency now is getting less. So your near vision today is not important. It's your intermediate vision and your distance, because your mobiles are here, your tablets is here, your laptop, computer, all are here.
Okay.
When if you're driving, everything is here. And if you really want to attempt something which involves a little bit of risk, then there are multifocal lens implants that we can put.
Okay.
But I would not advise someone 40 to take a risk for a multifocal lens implant, which there could be a risk of getting an infection and then losing your eye.
Because I think the eye is the only thing, even if you lose your sense of smell, your hear, your speech, but if your eyes are gone, I mean, that's one of the most difficult thing over there. Okay, so you're located at South Mumbai, so you do your operations there only, your LASIK operations, everything?
No, LASIK, I do it in Bandra. We are 6 partners in that whole project.
Okay.
6 eye surgeons that are there, and the only center which is, you can say, controlled and operated by eye surgeons, and not. There's usually a businessman involved.
Correct.
Because of the amount of money that is there. Yeah.
Okay. So social media, which social media platform you're comfortable with? I know you don't use so much. I don't see likes and all happening over there.
Yeah. Well, I think now, you took my interview, 6 years ago. And I said how Facebook actually changed my brand's visibility. And it did then, because a lot of my friends who were not in touch with for a long time suddenly knew who I was, what I was doing, understood the type of things, and showed interest in what I was doing.
Correct.
And now every Tom, Dick and Harry is my friend on Facebook. So Facebook is right now not so effective.
Okay.
And earlier, and I don't know if you remember this, but you asked me something about LinkedIn.
Yes.
And I said LinkedIn at that moment of time, not meant for a doctor, maybe more for business. But I think now in the world of collaboration, when you're looking to collaborate, so I look to collaborate with a lot of diabetologists, a lot of opticians as well. LinkedIn is a good forum to find them, communicate with them, and you do get responses and things like that.
Okay.
I think now the number one networking tool for a doctor is actually what I'm doing right now. So it's the face-to-face networking, trying to help people out. You can only build trust with this.
Absolutely.
Not with your digital forum. In terms of my current patients in communication, WhatsApp is brilliant. Some doctors find it odd, but I get a lot of reports, scans from all over the world via WhatsApp.
Okay.
Instead of emails and things like WhatsApp has made it a lot easier. And there are a lot of other applications now which you can use, which you can actually have your own application in which all the files of your patient are downloaded, and you have a copy of it, and the patient has a copy of it, right in the application. So it's removing paper all completely. Absolutely. So that is something that is actually, rather than the typical social media, this is now something that I'm looking into. Yeah.
Okay. Hobbies and family. Tell us something about your family and your New Year's family member. He's got a new family member.
Yeah. So I've been married now for, let me get the years right. Not one.
She's going to watch the interview, right?
Yeah. So it's been 18 years.
Wow.
My wife's name is Uttara, and I think she's the only one at the moment. Yeah, she is the only one at the moment. I've got a 10-year-old daughter named Shania, and she goes to École Mondiale School. She's going to be in the 5th grade now. And I've got a second daughter who's a 7-month-old golden retriever puppy. So it's a
Full family.
it's
now.
it's a house full of strong women,
Okay.
and I'm the minority in that, and it definitely feels good. So I've got a lot of strong people on my side and my support for that.
Okay. Your hobbies?
The dog what supports me the most.
The most supports. His profile photo is actually the dog, you know, on WhatsApp. So like, he kun acha okay dog ke.
Yeah, but they're extremely loyal, and she waits right at the door for me for 8 hours for me to come.
My God. Okay.
So that's loyalty.
Fantastic.
My wife doesn't wait at the
Why
door.
does wait? Okay. Hobbies.
Hobbies, I like swimming.
Mm.
I like watching sports. I like a general hobby, just hanging out with friends, traveling for sure. So thrice a year, a foreign trip. Yeah, and that's it. And I'm striving now to look for peace.
Okay.
Go somewhere where you have the ultimate peace.
Peace हो रहा है.
Yeah.
No mobile, no. Mobile तो रहेगा. Okay.
Occasionally
Occasionally.
the mo-
Occasionally. So now, thank you so much. It was
Thank
fun. So that's for your Nespresso machine. I have to see it next time over there.
Coffee is another hobby, yes.
Coffee is another hobby of his. Yeah.